I'm Dr. Joel Cohen from Denver, Colorado, and I'm at Maui Derm. And I've been excited to really talk about what's new in neuromodulators and what's new in fillers and combination rejuvenation, particularly around the mouth. So on the horizon from Allergan, we have a botulinum toxin type E. This is something that is quick onset, short acting, and it's really exciting to see this data from the clinical trial that I participated in. And we're anticipating this product coming out. So for people who've never tried a neuromodulator, this is something that, it's essentially a kind of try it on. You get to see how it looks, how it feels, and really what this overall effect is to see if you want to proceed with a neuromodulator that has a longer duration after that. So that's been an unmet need. Secondly, from Galderma, we have a liquid toxin ready to use. This is a formulation where you don't have to reconstitute the powder. This is all ready to use. You receive the syringe, and this is on the horizon as well. Not yet FDA approved, but actually used in Europe at this point already. So this is relabotulinum toxin. I also spoke about combination rejuvenation around the mouth. And it's important to realize that people, as they age, have different manifestations that happen that start to bother them. So one thing is, as people animate, and women particularly, they start to get lines etched in the skin, and the muscle columns from the orbicularis oris muscle, which is a sphincter-like muscle which is pinching in the area, creates these vertical muscle little areas that start to imprint lines. So when people have the musculature and it's just starting to imprint lines, you can off-label use a neuromodulator very precisely and be more centrally located to decrease the mechanical activity of these muscle components from imprinting the lines. So we can use neuromodulators specifically for that. Secondly, when people have imprinted lines in the skin, and if they're lines that are big enough to get the tip of the needle in and they're not numerous, we can use filler. We tend to do more serial puncture of filler along the way, and we can decrease the prominence of these lines. And you just want to make sure that you really use your thumb to integrate this product into the lines so that you don't see any lumps or bumps. But this could be a great way to really address the lines that are starting to form in the skin, as long as they're not numerous. Once you have numerous lines, and you have lines of different caliber in different areas, then we tend to do resurfacing. You can see some improvement from fractional ablative resurfacing. I tend to use more full field erbium resurfacing just to really treat the entire area, pick the right tool for the job. You have an endpoint with that with pinpoint bleeding, and you can see really nice improvement oftentimes with one treatment with full field erbium. Or if people want fractional treatments, you can do fractional ablative resurfacing, oftentimes over a couple treatment sessions. And you may actually be able to facilitate the healing process using some newer products out there. So for instance, Ariessence is pure platelet-derived growth factor, and there's some studies and some folks using it really indicative of people who are healing a bit more quickly. In my experience, using it about 1.5 years at this point. Oftentimes we see patients heal about 20% quicker, sometimes up to even 30% quicker, particularly for some of the more deep treatments for acne scars.